Hello, everybody. Andrea Trowski here with Dental L Tutoring, and this is another patient edition file. So what that means is this is perfect for those patients who have some dental questions and they don't know who to ask. But this is also nice for those new dental hygienists or dental assistants who want to learn more. Because I have been a tutor now for about 13 years. So I tutor dental hygiene students and dental assisting students all over the world, and I love it. So I am always happy to help. I still work in a dental office about twice a week at the most because I love seeing people and I love just teaching people everything about their oral health. So it just kind of made sense for me to do something like this so that I can reach more people. So a common question that I have been getting lately from patients are, from teenagers, from those who are in their 30s, 40s, 50s, it doesn't matter. But people are asking me, where does stain come from? Why do my teeth stain so quickly? And what can I do about it? So you might be thinking the easy answer is, well, to whiten your teeth, but that's not the easy answer because sometimes there are so many different whitening options out there. Some of them do nothing. Some of them work really, really well, and some of them may work, but they make your teeth super sensitive, not to mention very expensive. So let me kind of break this down a little bit for you. So you might be looking into a whitening toothpaste. I myself use a whitening toothpaste. But to be honest with you, it doesn't work that well, okay? So if you have stained teeth now, the whitening toothpaste won't do anything for you. What it does do, though, is it does help to limit, I guess, more stains from happening. So it does help to take little bits of stain off, and it does help them from sticking to the enamel too much. But the thing about those toothpastes are, if you have thin enamel to begin with, and you may or may not know if you have thin enamel or not, but if you do have thin enamel to begin with, it can make the teeth very sensitive, and nobody wants that. Because if you look at those toothpastes, they're a little more coarse. That's why they can call them a whitening toothpaste. But anytime a toothpaste is more coarse, it means that the teeth could become more sensitive because it does take a little bit away. So if you have thin enamel, you do not want to be using a whitening toothpaste. So if you're not sure if you have thin enamel or not, talk to your a dental hygienist or dental assistant, and they should be able to tell for you. Now, like I said, though, that isn't something that you want to use if you are looking at your teeth now and say, I have stained teeth. Your toothpaste will do nothing for you. A toothpaste is more for those who don't have stained teeth now, but they kind of want to keep their teeth as white as possible. Now, the next thing to use is you've probably all heard about those, Crest white strips. Now, they will help to whiten the teeth a little bit, but they don't have a very high concentration of peroxide in there. So it can only lighten the teeth about half a shade lighter. But if you're like 20, that might be all you need. If you're 65, you probably need something a little stronger because otherwise it's just a waste of money. And another thing that nobody tells you is that if your teeth aren't perfectly straight, the white strips will not stay on because they are meant for everybody, right? So they're not custom. So when they make these trays, they use pretty much a mouth of the average shape and size and perfectly straight teeth, right? So if you think about it, if your teeth are, tipped a little bit, crooked, which is normal, who cares, right? But they have nothing to stick onto, so it's a waste of money. Those who do have perfectly straight teeth, lucky us, right? But those that do, keep in mind that your teeth could be very, very sensitive because it does have a peroxide in it. So if you want to use the white strips, you can, but I do suggest using a Sensodyne type of toothpaste 2 weeks before you use them, and then while you're using them, and 2 weeks afterwards, because those Sensodyne toothpaste help to form a thin protective layer over the teeth so it doesn't make the teeth as sensitive. You might be a little bit sensitive, it depends on the person, but not nearly as much as if you did not use a Sensodyne toothpaste. Trust me, you guys, it helps. The stuff is amazing. But if you want to kick it up a notch and either use those whitening kits from, like I've seen them at Walmart, Target, Sephora, you could try something like that, but they likely will not work for you. And I'm just being honest, unless you have perfectly straight teeth. And the thing about those kits, like I said, they are not customized for your mouth. So you might be spending $20, $50, $100, you know, who knows, but they're not custom to you. So you could end up with a weird shade, and then what? Then what, right? It's not like we can take that shade out for you. If you come see us at the dental office and say, look at my shade, it looks horrible, what the heck happened? Happens all the time. And we can't actually take that out or anything. It just means we would have to use our own whitening system to work with the shade you have now and make it look nice, you know? So truthfully, the best thing to do is come see us for a customized whitening option, because the products we use, the hydrogen peroxide and carbamide peroxide as well, is usually a minimum of 10%, and it can go up to like 35%, 40%, 50%, but we usually start people off at a 10% combination, because that's all people need. If you go higher, things can get really, really sensitive. The only time we would go higher is if you have the in-office whitening. So I should also mention, there's typically the in-office whitening and the take-home option. The in-office is for if you need or want your teeth whitened that day, okay? So those who say, I'm getting married next week, I kind of want my teeth white now. That is the best option for you, because you will be like white that day. It's amazing. The hydrogen peroxide, though, is about a 35%. So that's a much higher percentage than a 10%. So it's common to get tooth sensitivity. So start to use the Sensodyne toothpaste so that does not happen. It works every time. It is awesome, awesome stuff. The take-home option is usually less expensive, and in my opinion, a much smarter option if you can do it, because you whiten over time. It takes usually a week to 2 weeks, but then this way, the teeth aren't as sensitive, and you can make your teeth as white as you want. You know, like I don't want my teeth white, white, white. I want them to look natural. So I prefer actually the take home option so that I can look at my shade and then stop when I'm at the shade that I want. So if that makes sense. So I use the take home option and I get a 10 to 16%. And that seems to help me. And I typically whiten every year and a half. That's all I need. But I always use Sensodyne toothpaste, so then that way my teeth are not cold sensitive. Because how the take-home option works, and same with the in-office, is we would take impressions of your mouth first, and then we send those impressions off to the lab to have your customized trays made, and then either us or you put the whitening solution in those trays, leave them in for a minimum a half an hour up to 2 hours, depending on the product. And then that's it. It typically takes 3 days to 2 weeks to whiten. So that's not bad, right? Pretty simple stuff. So if you have stained teeth, that is an option for you. But come talk to us first, because let's just say you're age 60, right? We would have to use a certain system for you depending on, you know, the type of stain you have, because there are many different types of stain. If you're a smoker, you would use a different system, because you would probably have to have a pretty heavy duty whitening system. And we typically say to stop smoking, because if you're smoking, then the stain will come back right away. But I'll save that story for another day too. But yeah, though, like if you guys have questions, there are options for you. It doesn't matter if you're 18, 25, 38, 44, 65, whatever. You do have options and whitening is possible. A common question is whitening safe? Yes, it is as far as we know, and that's what I say because it hasn't been out long enough for them to do proper tests. It's been popular for maybe 10 years and that's it. So yes, they have done tests and they have seen that it is safe for the enamel. It's not eating the enamel or, you know, taking anything away. It is safe because the enamel opens up, for lack of a better word. It absorbs the whitening and then that's it. But don't swallow it. Don't put the whitening trays in and then take a nap. Then it's not safe because you're not supposed to swallow it. Plus, it's nice to have it done in the office because if you don't do it properly, and let's say you get some like up here, down here, it can burn like nothing else, okay? It's meant for the enamel and the enamel only. So I hope that helps you guys. If you have questions, let me know. So there are options out there for whitening. I whiten myself every year and a half because I don't know, I like to kick it up a notch, right? Why not? I color my hair, so why not whiten? So yeah, you guys, so I hope this helps. Let me know if you need anything.